Your Excellency, sir, the President and Commander-in-Chief of the Armed Forces of the Federation, the executive governors here present, especially the Chair, Governors Forum, my governor, please permit me to stand on the existing protocol. I represent the Nigerian Universal Coverage Forum, which is an assemblage of a wide array of stakeholders, donors, partners, civil society, and CBOs that are committed to supporting the aspiration of government to achieving universal health coverage. Let me use this opportunity to congratulate the Mr. President, the Honorable Minister and Governors and traditional rulers on the occasion of unveiling this narrative-changing blueprint for the health sector and the historical signing of a compact between the national government and the state government that will accelerate implementation of the blueprint. Let me quickly thank Mr. President for prioritizing universal coverage in his pre-election manifesto and the post-election policy agenda as well. And again, to thank him for giving us very, very vibrant leadership in the health sector in terms of the Honorable Minister, the Minister of State, and the Special Advisor who are well experienced and accomplished in this sector. And again, it doesn't stop there. Mr. President appointed a lot of health personnel in other sectors as well, from sports, from environment, and other sectors, including education, which makes a multi-sectoral collaboration aspiration a feasible one. I would like to thank our governors as well for their commitment to the health, despite the very challenging economic situation they find themselves. However, sir, the largest room in the world is room for improvement. We'd like to use this opportunity to ask for improved spending for health, especially to ensure that the equity fund for health at the state level is released to take care of the poor and the vulnerable. Your Excellency, sir, you have an ambitious goal of leapfrogging health insurance coverage, especially to the poor and the vulnerable. So the community have asked me, and the Nigerian Universal Coverage Forum have asked me to request, sir, that Your Excellency, this aspiration is a great one, and this is the first time we're having that kind of aspiration. But they've asked me that we have to look at, revisit the financial architecture for health to be able to make that lofty aspiration a reality. They told me to ask you, Your Excellency, that we need an innovative, to consider innovative approach that will help us to pool sizable amount of resources together to be able to expand health insurance to the poor and the vulnerable. They've identified a number of areas, and they asked me specifically, it's not the technical aspect that is not there. They've asked me to please and throw the weight behind this lofty innovative financing, looking at alcohol taxes, telecom taxes, tobacco taxes, and everything. And they are specifically asking for an interministerial committee that will look at these and to mobilize the resources and deploy it. Secondly, they've asked me to make a request for us to increase the accountability bar in the health sector, for the chief executive at the national level and the state level to constantly ask questions about the money being spent on health, how much of health is that money buying, so that all of us will be alive to our responsibility. On a final note, I would like to, they asked me to assure His Excellency and the governors that the civil society community under the umbrella of Nigerian USA Forum is with His Excellency at the national level and the state level towards ensuring that their ambitious goal of expanding health insurance to the poor and vulnerable Nigerians, that we are with the government in this process of making history, of being the first administration that will put Nigeria on the UAC course. Thank you very much.